And we're on.
Hello, everybody, and welcome to Toni Peters' first podcast.
Yeah. Is that what it's called? Toni Peters?
Toni Peters.
Toni Peters podcast?
The Toni Peters podcast, yeah.
It's got to be Dr. Toni Peters podcast.
The Dr. Toni podcast. How about that? The doctor name to be determined. And how about the name TBD podcast?
Name TBB. I think that's been used before.
Probably. For now, we'll just go with Dr. Toni's podcast.
Sounds good to me.
And this is my first podcast, and what I hope becomes a series that may be helpful for however many people.
Why wouldn't it?
Listen, right?
Well, because you keep whacking the microphone. That might be.
Yeah,
my unstable mic.
That'll lose listeners pretty quick. Making microphone noises. I guess my hope with this podcast is just for people to be able to learn more about healthcare issues and their own health and how their body works. And it was difficult for me to kind of decide where to start. So I was asking some people what they thought. And I think a big issue that people are hearing a lot about right now are things maybe related to some of the things actually that are going on in the government and how that can affect our political issues, unfortunately.
People being placed into office.
People,
not elected, but.
Yes, people who have been placed in, and specifically, Robert Kennedy Jr. has been named Director of Health and Human Services. But there's other things that are going on as well with some of the recent budget cuts, or where they're trying to, and I think so. There may be some discussions in the future about what U.S. aid, which many people have heard of in recent days, as the Doge people have cut some of that funding and things. So what are some of the things that U.S. aid was instrumental from a health standpoint and doing around the world? And, where are the implications? Donald Trump took the United States out of the World Health Organization, and what are some of the potential implications of that?
Who?
Donald Trump. It took us out of the World Health Organization. Oh, yeah. So
during COVID, that's what I always.
Yeah.
Everybody would talk about. Every time you listen to the news about COVID, they bring up the World Health Organization. I'd just be like, who? It's just made my COVID.
The WHO joke. Yes.
Yeah. Just made COVID go by a lot faster for me.
Right. Making a lot of who jokes. Yeah. Anyway. I did not understand you were making a joke. So this podcast
you got to remember that 95% of the stuff out of my mouth is a joke.
Right.
So I'm trying to teach Kevin
still. Podcast is
still.
getting off to a great start as I'm like, what are you talking about? Who? What? Donald Trump?
Should I just shut up? No. I'm here to make
helpful.
It lighthearted.
But where I thought I would start is chatting a little bit about vaccines, because Robert Kennedy, who has been named Director of HHS, Health and Human Services, has a history of being pretty strongly anti-vaccine, although now he's backed off with his confirmation hearings and things, kind of backed off on that a little bit. But, I'm going to try to not be political during most of these, stick to facts, stick to why vaccines are recommended, stick to that sort of stuff. But where I thought I'd just start today, you can go. Do you have a way to go to switch the slides?
Yeah, I do.
Ah, that's helpful.
Over there.
So where I thought I would start today is just a little bit of the history of vaccines and why they're so, and how did we get here? Why did people develop vaccines for some of the diseases? And this is unfortunately not, we don't have the time to be all inclusive in this discussion, but I figured we'd kind of start with the basics of a few things and then kind of go from there. So, and you can go right to the next slide already. So, the history of vaccines or inoculation actually is quite old. Potentially goes back.
Do you want it bigger, the other one? Do you want it bigger, the other one? You want the...
Oh, no, okay. You mean up there?
Yeah.
Oh, no, I think I mean, there's nothing particularly that people need to see on this slide. Anyway.
Well, Nick's not here. So,
the history of vaccines or inoculation is actually quite old and potentially started back as long as almost as 3,000 years ago. Probably started in China with the Buddhist monks. But there was no written history of it because there was a taboo about it, and so none of it was written down. So this was purely an oral, sort of tradition passed from one monk to the next, consider a little bit of the practice considered sort of magical or spiritual in nature. But one of the first ways inoculation started was with smallpox and potentially other illnesses, with taking some infectious material identified from a person who had the illness and then scraping the skin on somebody who had never previously been exposed and, applying that infectious material directly to the scraped skin.
Really? Or
having individuals inhale it through the nose. Assuming, oral, having people ingest the infectious materials.
Was this initially an attempt to get them sick?
It was
we'll put you to death by getting you sick.
It was an attempt to get people mildly ill in a more controlled situation, and not get as ill as if they had a larger exposure.
They kind of knew-ish what they were planning on doing.
Even though there was not, 3,000 years ago, they didn't even have germ theory yet. They clearly understood that these diseases passed from one individual to another, and understood that there maybe was something something in whether it was sores with certain infectious illnesses or phlegm of certain illnesses that potentially had what was making people sick in it, and that exposing people to it in smaller, limited doses maybe would help them not get as sick as if they were exposed to it in a more natural way.
Find this in literature? That they were doing this? Or how did they historically find it?
Not the, like I said, there's no written history of it. There's just still sort of to this day, gotta stop hitting the microphone.
You'll get used to it after a couple episodes.
There still was just sort of oral history, even that comes down to this day, of people were doing this, people have been doing this for thousands of years, or had been doing it for thousands of years. So eventually the practice was written down, and the first time that's really sort of recorded is when it spread to Constantinople, or what is now Istanbul, Turkey, in the 1600s. And from there, then it spread to North Africa and Europe. It was, this inoculation was brought, and this is probably specifically for smallpox at this point in time, was brought to the Western Hemisphere, and specifically North America, when there was an enslaved man by the name of Onesimus. Onesimus. I'm sure I'm saying that wrong. So it was brought, he reported, and to his owner, who was Cotton Mather. We can talk a little bit more about him in a minute, but
So this was a slave situation?
This was a slave situation. He was an enslaved man, and he reported that he had been inoculated for smallpox while still in Africa, and that the enslavers in Africa were inoculating individuals because they could get a better price for them if they could say they had been inoculated against smallpox. So Cotton Mather, who that may or may not be a name people are familiar with, but he has some connections to the Salem witch trials. He was a Puritan minister in that area. Wasn't a judge, had no official role in the Salem witch trials, but is considered by many to have sort of somewhat stirred the pot, so to speak, around that time, and actually did write a book defending the Salem witch trials after it occurred. So he was, a Puritan.
Defending them. How,
defending that
they were witches?
Yes. Okay. I mean, I should not say that. I have not read the book he wrote, but essentially saying that the actions of where 19 people were hanged and one pressed to death were appropriate.
Huh. I've been hearing a lot about that being like as a result of mushrooms.
I think people have a lot of theories about what it may or may not have been, and I must admit I don't know a whole lot about that theory or where that theory is coming from. I think what we can definitely say is that religious zealotry and other things don't necessarily need hallucinogens to result in
no, you're probably right.
To result in unfortunate actions. So anyway, so that was how it was. And then there was a smallpox outbreak in Boston in 1721. So Cotton Mather and one of the local physicians, whose name in the resources I had was not able to identify. But then, Ben Franklin gets involved in this about a couple of decades later. He actually had a son die of smallpox in 1736, and so he became a strong advocate for inoculation and the protective effects of it. So he wrote several articles regarding the procedure, and actually was one of the first people to actually document any data that showed that people who had been inoculated were less likely or did not develop the smallpox disease with, natural exposure and had improved outcomes.
I've never really understood the big deal of smallpox. I mean, there's smallpox.
They're smallpox, but they're very deadly. We will talk more about that in a little bit. So George Washington then, because they felt like there was proof that this was working, ordered all troops to be inoculated for smallpox during the Revolutionary War. And there's also so it
began with George Washington. The ordering of inoculations,
right? I do remember seeing a lot of this on social media when people were upset about maybe COVID vaccine mandates and things like that.
Right, yep.
And people would post things like our founding fathers, they never would have wanted this, blah blah blah, and all the people would respond like George Washington literally ordered every member of his military to be inoculated against smallpox. So clearly understood the importance of immunization and inoculation. So I think it is dangerous to speculate on what our founding fathers would or would not have wanted at any point in time. But clearly, at least in this instance, he was in favor of it. So
after having a son die of it, for sure, yeah.
Well, yeah, and that was Ben Franklin whose son died of it. George, yeah.
They probably knew each other.
They knew each other. I'm sure he knew plenty of people who had died from smallpox. It was not uncommon back then. So a few years later, this was around 1796, Edward Jenner noted that individuals who had previously been exposed to a similar illness called cowpox were immune to smallpox. Now, cowpox was often transmitted from, wait for it, cows. And so milkmaids and individuals who work closely with cows were often those exposed. They would get similar looking pox to what the individuals who had smallpox had. but it was not considered typically a deadly disease. It would, maybe left some scarring or things after people had the illness, but typically resolved without issues. So he inoculated individuals with cowpox and noted that then those individuals did not develop smallpox when exposed to smallpox later on. So that is then the smallpox vaccine was switched from inoculation with actual smallpox infectious material to inoculating people with cowpox and generating immunity that way, because there were enough similarities between the virus and how the immune system responds to the virus. But that was really the whole history for immunizations until about 80 years later, when a guy by the name of Louis Pasteur, who people may have heard of because he's also behind pasteurization of milk products. So he introduced the idea of attenuation of viruses.
Meaning?
So what he did is he had rabbits who were infected with rabies. By that time, they did know that rabies affected the brain and central nervous system. And so he would then kill those rabbits, use their brain material to expose other rabbits to rabies. And theoretically, they were getting the viruses were getting more and more weakened, okay, that each rabbit was getting. So by the time, and I don't remember how many rounds of rabbits he had to go through, but by the time he got to, 10th round of rabbits or something, they did not develop symptoms even when exposed to the virus from those prior rabbits, if that makes sense.
Mm-hmm.
So
totally makes sense.
It's an active virus, but it's very weakened and not capable of producing the pathogenic effects. I can probably explain that better with more preparation.
Move on.
Yeah, so move on. So going back to the smallpox one. So what was the smallpox illness? So it's actually caused by a virus called variola. It's considered probably variola, starting with a V. It is an ancient disease, and there's possible evidence of smallpox lesions on Egyptian mummies who would have died around 3,000 years ago. There's written descriptions of smallpox in China in the 4th century. This is a severe disease. They call it smallpox, but 3 out of every 10 who were infected died. Survivors were often left with horrible scarring and disability. So they used to specifically call this variolation, like when they would do the inoculation procedures, because the virus was called variola. They called it variolation if they were exposed in that more controlled setting to, they would take products from, you see this image of this child with smallpox. They would take break open one of those pustules, take the infectious material from inside the pustule, and then, through a scrape or cut on the arm, they didn't have needles really at this point in time, and, just kind of expose the individual to it that way. So it did induce symptoms such as fever and rash. And here's kind of the key point: fewer deaths than natural exposure. So most people did okay with it, but you still probably had some deaths. So this was not ideal method for doing it, but probably was better than a natural exposure to a smallpox outbreak. So Dr. Jenner, as I mentioned, he's the guy who realized you could use cowpox. He started his experiments in 1796, and a little more detail about how he went about this is interesting. like I said, he had noticed that individuals who were exposed to cowpox or had cowpox seemed to be immune to smallpox. So there was a milkmaid who worked for him who developed cowpox. So he took the material from those pustules, inoculated the 8-year-old son of his gardener with it. Maybe one of the few people that he knew who hadn't previously been exposed to smallpox or cowpox. Experimented on
and the gardener approved.
Apparently, I think that's I think the informed consent question here is very questionable. Not here to defend medical experiments from 200 years ago, but anyway, they exposed this child to cowpox, and then a few months later purposely exposed him to people with smallpox. And fortunately, the child did not get ill. So he felt he had proof of concept, and then did that sort of thing a few more times. And then in 1801 published an article on the origin of the vaccine inoculation. And then from there, things really sort of took off and it became more widely accepted. They did, at some point during the 1800s, switch from using cowpox to a vaccine called vaccinia. It's in the same family as cowpox and smallpox. And
that also looks like another naughty word.
Right. But also,
I don't know if it's a naughty word.
But, less symptoms than you got with the cowpox vaccine. So, or with the exposure to cowpox. So, the last case of...
Is it a similar pox sort of disease, I would imagine?
It's a similar... I'll be honest, I don't know much about the vaccinia virus, but I think it's in that same family, produces a similar immune response.
I'm assuming this is where we're going to get the name vaccine from.
Yes.
Okay.
Or they named vaccinia after the fact that they were going to use it for a vaccine. And I must admit, I don't know which is which. That'll be... I should jot down notes with good questions, and then the next podcast, the first part of...
Well, you can just watch this again.
Yeah,
that'll be your notes.
Right.
It is recording and will be published.
First part of every next vaccine will be corrections and omissions.
Corrections.
And
I apologize for harming this animal.
Right. Corrections, omissions, and answers to important questions. So the last case of smallpox in North America was identified in 1952, and very shortly after that in Europe, Western Europe was eradicated in 1953. Who?
See, it's fun, isn't it? Isn't it fun?
Yeah, right. So they developed a
Who's they? This is the World Health Organization, everybody.
World Health Organization, of which the United States is no longer a part.
Who was around before 1959?
Yes.
Really? When did do you know when they organized?
I don't. Another good question.
Hey Siri, when did WHO organize? Hey Siri, when did WHO organize?
You're going to get information about the WHO and their...
I can use ChatGPT to answer that. Seriously?
Why would you not just answer it?
Yeah, okay. No, never mind. We'll figure it out.
Okay.
We'll have that in the corrections.
Another question for our corrections and omissions.
But it was prior to 1959,
Prior
obviously.
to 1959, apparently.
Yeah, I had no idea it was around that long. I thought it was like a 70s thing.
Yeah. So they started that in 1959, but it didn't really gain traction for almost another decade when they got some additional funding and other resources. So then this was a global immunization project, basically. And the last case in South America was identified in 1971, last case in Asia, 1975, last case in Africa, 1977. So it is interesting, though, I said the last case in Europe was in 1953, but there actually was a case in England in 2008 because there was a medical photographer working at, I think it was Birmingham Medical University. Once again, that might be something I'll have to do. Corrections and omissions. Exactly where was this young woman? But she was a healthy young woman working a floor above the biomedical research place where they were doing work on the variola or smallpox virus. It's thought maybe she got infected through air vent. This is an airborne illness. And yeah, she died of smallpox. And then her mother, who was caring for her, got infected but did not pass away. So there was a case fairly recently, a case in England. So, but now there were for a while like 4 countries who had stores of the variola virus that people could do research and things on. Now there's only 2 locations where the variola virus is stored, the Center for Disease Control in Atlanta, Georgia, and then a place called the Vector Institute, which is in Russia. This is all supposed to be under World Health Organization, or WHO, guidance. But unfortunately, the U.S. is no longer part of WHO, so I'm not sure how that applies anymore and if they have any global oversight on that. So another vaccine people are aware of, or disease that people are aware of, sort of the success story of vaccines, is polio. It is likely also an ancient disease. But what's interesting is that outbreaks were really only first noted in the late 19th century, so late 1800s. This is, it's thought that the outbreaks maybe are because, there's theories about why we didn't really see outbreaks until, more recent times. And they think it may be because of sort of industrialization, more people living in large cities, but also you did have general overall improvement in conditions around that time and cleanliness. And so that perhaps, prior to that time, most babies were being exposed at very young ages when they were less likely to develop, the paralysis symptom of polio. But if kids aren't exposed until they're a little bit older, like school age, they're more likely to develop those symptoms. So there's some thought that maybe delayed exposure played a part in why you started seeing outbreaks in the late 19th century. So this is a virus.
So quickly,
oh yeah,
word vaccine.
Yeah.
Comes from the Latin word of cow, vaca, which they still use in like Spanish. Vaca is cow.
Oh, well, I suppose that was derived then from the cowpox, and then the vaccinia virus is probably also a cow pathogen. And yeah. Okay, interesting. So the polio virus has what we call fecal oral transmission, which sounds really, icky, but basically
eating poop, audience.
Right. That means you have been exposed.
My dog does it all the time.
Right.
Did I tell you that story real quick?
Oh, sure. Go ahead.
We had an aging Boston Terrier who couldn't get up, and it was like his stools came on really fast, and he would sleep with me for like 15 years of his life. So we just put a towel down next to us overnight, and he would start moving in the morning, and he couldn't get up, and he would just go, and sometimes in the middle of the night.
Yeah.
But my old man now, Ozzy, loved special food or something with the old Boston Terrier, right? So he just loved his poop, right?
Yeah.
So he learned the word poop. My other dog, and then we just go, Ozzy poop, and he'd run up and eat it. Just fold the towel over and we go back to bed.
Yeah, dogs are great. And
I'm not sure if he ever got polio, but
one would hope not. Although maybe that's why your other dog couldn't couldn't move anymore. No, I'm just kidding. Yeah. So fecal oral transmission is actually very common. It's how most of our stomach flu bugs, the nausea, vomiting, diarrhea, bugs like norovirus, like rotavirus, how those are transmitted. And, it just needs to be on your hands or something and then you touch something and So it's easier than you would think and doesn't require direct exposure to somebody's, we'll just say fecal material. But the virus can also contaminate food and water, and that's, potentially also where you would see some of these large outbreaks. So the virus is actually very highly infectious, enters through the mouth, and then multiplies in the intestine. It's interesting that about 90% of people who actually are exposed or have poliovirus, they are asymptomatic. They have no or only very mild symptoms.
I did not know that.
Now, I'll be honest, I didn't either, because even as a physician, polio is not something we see anymore. So it even wasn't seen much recently before I started medical school. And so it wasn't, talked about in a great deal of specificity. So most symptomatic and most people who develop symptoms will just get, very sort of non-specific symptoms like fever, fatigue, headache, vomiting, stiffness in neck, pain in the limbs. So, it could be the flu, kind of thing. And most people recover without issue. However, a few infected individuals, and this is the sort of thing, like we don't know, like why would I develop paralysis and you didn't? These are the types of things we just don't know.
Could be a problem with the vaccine.
Well, it stopped happening after the vaccine. So one would assume it was not a problem with the vaccine. But anyway, the paralysis that developed was usually of the legs. FDR being sort of the most well-known case of that, with his lifelong paralysis due to polio. But the paralysis could cause death because you could have paralysis of muscles all the way up into the chest and into the muscles that assisted with breathing. And so then that's where people either died or they needed to be in iron lungs to help support their breathing. Boy, I was gonna know a little bit more about iron lungs and how they work, but basically it works differently than like how our respiratory machines work. How an intubated individual works now, like so we probably would not be using iron lungs. Say if something similar were to happen now, we probably would not be using iron lungs. People would probably have. We'd probably have a different situation. But an
iron lung is a mechanical ventilator that was used to assist patients with respiratory paralysis, such as those with polio. Invented in 1927 by Philip Drinker and Louis Agassiz Shaw at Harvard, blah, blah, blah. It's a large airtight metal cylinder that encloses the patient's body up to their neck, creates a negative pressure environment, which causes the patient's chest to expand and contract, simulating breathing.
Yeah, so that's very different. So basically, almost like a vacuum, if you think about it, that would, force the chest to expand and draw air in. So that's very different than how ventilators that we use now work, where basically you have a tube in, sometimes through the mouth, even through the nose. Sometimes if somebody's going to be sort of chronically ventilated, through their, directly into the trachea, through the neck. And then we do positive pressure directly into the lungs to expand the lungs. And so that's...
You blow air in there.
You blow air in, yes, basically. And the way the iron lung basically worked is it sort of, like I said, the vacuum externally causes that chest sort of passively to expand, but that draws the air in. Yeah. So But there was at least one individual who, and I believe it was due to polio, was in an iron lung up until and I think he was in Australia, and it was not, and there was some stories about how nobody uses iron lungs anymore, and his iron lung would break down, but there was one person who knew how to fix his iron lung, and they kept this iron lung that was decades old.
It's like living in a bubble now. Like nobody lives in a bubble.
Right. Yeah. Exactly. So anyway,
at least I'm not sure.
Right. We are not aware. The people in this podcast are unaware of any people living in bubbles at this point in time. Although I do know, I have taken care of and know kids who have the bubble boy disease, which is actually known as severe combined immune deficiency. But that's
so
another
what do they
podcast.
Live in now?
Well, they're
we're sorry, a little bit off topic, but this is interesting to me.
They don't.
They don't live.
You try to restrict their exposure to infectious illnesses, but the reality is
everybody around them lives in a bubble.
They metaphorically live in a bubble, or figuratively live in a bubble, just not literally anymore. Where it's okay, you. But
do they have new systems?
No. So what you do for people with that disorder now is they go to bone marrow transplant, and via getting the bone marrow from another individual, get a new and functioning immune system.
Okay.
And so.
So
and
they actually
ideally,
have some way to resolve the situation.
Right. And ideally, you take them to transplant when they're those kids usually it can be diagnosed on the newborn screen, but if they, for whatever reason, haven't had the newborn screen and get sick, the idea is to take them to transplant very young before they start having a lot of recurrent infectious illnesses.
So then when they transplant bone marrow, that's usually a one and done thing. It's not a system of transplants. In one way, it's a one and done thing. So you give the individual treatment, usually regarding chemotherapy and maybe radiation, that wipes out their existing bone marrow. And then it's a one-time thing in the sense that then they get an infusion of bone marrow, whether it's from a related donor, unrelated donor. And that just runs in like a blood transfusion, and those bone marrow stem cells find their way into the bone marrow and start reproducing and making making new blood cells. So it's kind of a one-time thing, and realistically it should be curative, but the whole process there's a lot of risks to going through bone marrow transplant, primarily infection and things like that, because it takes a while for that new immune system to fully establish itself. But and then it takes a couple of years for the new immune system to be fully functional. So yes, it's a one and done process, but it's a long process requiring a long hospitalization and a lot of follow up in the couple of years afterwards. So, but ideally, somebody a year or two after transplant is living a healthy and normal life. So okay.
Yeah. Well, that was a bit off track, but that's okay. That's a very interesting disease and something we can maybe talk about more at some other time. So there is no treatment for polio. There's only supportive care. And who knows if that would be different? Like if the vaccine hadn't been so successful, people probably would have been putting a lot more effort into finding a medication that treats polio. But back in the 40s and 50s, there was no treatment, only supportive care. So in the 1940s and 50s in North America and Western Europe, you started seeing these large summer outbreaks. And so people really would restrict, there were years where people were just like, we can't go to the pool, we can't go to the movies, we can't, it was sort of like COVID, and that sort of thing at that time.
Were they wearing masks?
Well, masks wouldn't have helped with polio. Yeah.
I love that. All right. Oh, man.
So I don't believe they were wearing masks at that time. People did wear masks with the Spanish flu outbreak in 1918, so the masks are not a new thing. And I wear masks all the time. Well, anyway, masks might be a whole other podcast. Yeah. So polio really sort of peaked in the U.S. in 1952. There were 21,000 cases of paralytic polio recorded in the U.S. And
with a small population as there was in the U.S. in 1952, I'm not exactly sure how much smaller, but it's probably at least half.
Yeah, I'm not sure. Yeah, it was definitely smaller than it is now. I'm not. Yeah, like you said, I'm not.
I don't know.
Yeah, anyway, that's a lot of kids to suddenly be paralyzed in a year. Yeah. So, 1953, Jonas Salk developed the inactivated polio vaccine. This actually was trialed over a little over a year. It was given to over 1.8 million children in the first, second, and third grade. I just want you to think about how hard it would be to try and get 1.8 million parents now to agree to let their child be part of a vaccine trial. I think people just looked at this sort of thing differently back in the day. Anyway, this was approved for use in the April of 1955, and widespread vaccination was started. There was a new vaccine could be administered orally, actually, that was developed in the 60s and approved.
So it says live but attenuated. Tell me what.
So this is, yes. So this is sort of like what I was talking about with the rabies vaccine, where it's it's still the live virus, but theoretically it's weakened and
attenuated is like
right, and doesn't cause illness and weakened over generations. It doesn't cause illness in the individual, although I will say we don't give live vaccines to severely immune compromised individuals, such as bone marrow transplant individuals, patients of mine who are going through chemotherapy, we hold off on
if they've ever been transplanted with bone marrow?
No. So typically... So for most individuals who would get chemotherapy, they can go back to getting live vaccines about a year after completing chemotherapy. For something like bone marrow transplant, for a lot of vaccines, they'll start about a year after the transplant, but live vaccines, it's actually a full 2 years after the bone marrow transplant before they will. And there have been some suspected cases of people shedding this virus after taking the oral vaccine, and then other people developing the illness, with that strain of the virus. So they know it was masks. Because they weren't wearing masks. But because it made it easier for these large global vaccination programs, initially, this oral vaccine did become the predominant form of the polio vaccine for decades. Although now in the U.S., partly because of the risks of other people, especially immune compromised and things, being exposed to the virus that these vaccinated people are shedding. In the U.S., we've switched back to the injectable polio as the main form, but it is still. The oral vaccination is still widely used worldwide because it's cheaper and easier to administer in these global immunization projects. So by the 1970s, paralytic polio rates fell over 1,000-fold from pre-vaccine to 12 cases per year in the U.S. In 1994, the Western Hemisphere was declared free from polio, although there have been sporadic cases since then. So that's
like 24 years later. So they had 12 cases a year for 20 years, basically, before they finally declared them.
Yeah, I mean, I'm not to declare it free from polio, that would mean they weren't seeing any cases for probably at least a decade before they declared it.
So they basically forgot about it for a while, and then it went, well, what about polio?
Yeah.
Like, oh, let's declare that done.
Right,
Okay.
right. Yeah, I bet. Once again, I'm sure there's people out there who know, and so what are the criteria for saying we don't have this in our country anymore? But usually it's going to be years, if not decades of.
Are we still vaccinating kids against polio and smallpox?
Smallpox, no.
Yeah, because didn't everybody have like that little thing on their arm if they were smallpox vaccinated? I think I probably have one, and then that started
possibly. I know you
disappearing.
can also see scars from the tuberculosis vaccine that people in countries where tuberculosis is more endemic than it is here in the U.S. can have, but we don't.
When did we stop the smallpox one? Because I know I have one, or used to have those dots, and all my friends had the dots from. It must have been smallpox.
You're only a couple of years older than me, and you're
70.
not.
Oh,
I think they had stopped smallpox vaccinations long before that. So
I thought I had one.
they still do it for members of the military because there is concern that it could be, used as a biological weapon, things like that. But but it has not been a standard part of the vaccination.
I was right-ish about the population in 1952. It was 157 million, which is about, I think.
That is interesting that we've doubled since then, or about even more than doubled. Yeah.
Sorry, I got you taking a drink of water.
That was a really loud.
It's okay. We can do that one too and say, okay, there's our little podcast studio there. All right.
Yeah. So we do. So there have been. The Western Hemisphere was declared free from polio in 1994, but there have been some sporadic cases. There was a case in New York, not that long ago, like since 2000, but it was felt that it was an unimmunized individual who was probably exposed to shedding of the vaccine from somebody who had taken the oral vaccine.
Yeah, so me and all my friends growing up were vaccinated against smallpox. Routine smallpox vaccination in the United States was discontinued in 1972.
Oh, okay.
And I was born in 70.
Okay.
Yeah.
Yeah.
That's why I'm like I am.
Yeah. Because you're smallpox.
Thanks for agreeing with me.
Yeah. So we still do immunize against polio. And now here in the U.S., it is primarily the injectable form, and it is combined. One of the things we'll talk about at some point is all the now recommended like childhood vaccine schedule and combination vaccines and things like that. So the polio virus is typically combined with like hepatitis B or the Haemophilus influenza B and injection. And so you can kind of limit the number of pokes kids actually need. So the World Health Organization, who?
See, it's a nice time passing.
Right.
I'm sure that's not the first, second, or third time you'll hear that during your series of podcasts.
So in 1988, they called for the eradication of polio worldwide, sort of like they had done with smallpox, and they wanted it done by 2000. So this was not quite successful, but the only countries where polio is still considered endemic, meaning even if there's not necessarily outbreaks, they still see sporadic cases, are Nigeria, India, Afghanistan, and Pakistan. So
Kids are still vaccinated against polio?
Yes.
Okay.
Yes.
That hasn't ended yet.
That has not ended. Yeah.
Are there boosters? Like if somebody's traveling to India or something, are you required to get
I don't think so. There are special travel, physicians who, if you're traveling somewhere, you can see to get recommendations for extra vaccines they would recommend, or even, antibiotics or anti-malarials or whatever, depending on where you're going, that they would recommend that you should take with you. But I think the polio vaccine is effective enough that if you were vaccinated as a child, you don't need to worry about it as you get older.
Wow.
So measles is having a bit of a moment. Why did they want to come up with a vaccine against measles? So before
they packed those with mumps, right? Measles and mumps.
Yes. So
and rubella.
That is called the measles, mumps, and rubella vaccine. Yeah, they're all. Well, mumps is they're similar. Rubella is more similar to measles. Mumps, of course, it's one of those things we really don't see anymore, but it had pretty significant effects. Is it
like one vaccine for all three because it's effective against all three, or is it three different vaccines?
It's three different vaccines packed into one.
Okay, so it's not like cowpox kills smallpox.
Right.
It's a little bit different than that.
It's three basically separate vaccines that have always been combined.
Okay.
Or maybe not always combined. I shouldn't say that. I don't know that that's true. But they've been combined for quite some time. So we first started vaccinating against measles in 1963. Prior to the vaccine, it's basically thought that all children were infected prior to the age of 15. So you saw 3 to 4 million cases per year of measles. 400 to 500 people, and mostly children, died yearly, but 48,000 were hospitalized every year. 1,000 of those individuals suffered from what's called encephalitis, which is infection or swelling of the brain.
What's the percentage that die from encephalitis? Because that's a pretty...
Yeah, it's
fatal. Isn't it pretty fatal?
Yeah, it's likely. It's highly likely to be fatal. I don't know that I know any exact percentages.
There's another brain one that's very fatal too.
Meningitis.
Meningitis. That's kind of what it is.
Yeah. So encephalitis is inflammation of actually the brain itself. The meningitis, so meninges refers to basically the lining around your brain, and so that's what's inflamed in meningitis. And typically, what you'll see more often is that like bacteria cause meningitis. Viral illnesses are more likely to cause encephalitis. Okay. So measles was actually declared eradicated in the U.S. in 2000. They hadn't had any cases for quite some time. I graduated from medical school in 2000, and we were taught about measles, but essentially in the way of, if you do international medicine, maybe with some travelers or immigrants, but it was basically like you will not see measles. And of course, the older pediatricians who were training us at the time were more like, we're just talking about how, it was such a big part of what they had done early in their careers, and then, nothing. But now we're starting to see sporadic outbreaks, particularly occurring in areas with low rates of immunization.
Like West Texas.
West Texas. So, most recently there's been 130 cases described in West Texas and East New Mexico, kind of in a combined area. It is an area with known low vaccination rates. And last I heard, it was that 20 individuals, mostly kids, had been hospitalized due to the infections, with 130 some confirmed cases. 20 of them have been hospitalized, and one child has died from this measles outbreak. And I think one of the things that's particularly disturbing about this outbreak is the way our new HHS director, Robert Kennedy, is sort of downplaying it. Like, he's actually made some statements since this has started that are like, well, we see measles outbreaks. This is not unusual. This is unusual. Okay.
Aren't there a lot of cults in West Texas?
Oh, that I don't know.
It's probably the cults.
Well, there's, I don't know. We're seeing a rise in anti-vaccination for a variety of reasons. Over the last couple of decade in particular, we're definitely seeing a rise in people. And in this part, so this measles outbreak started in a county called Gaines County, where apparently like 20% of children entering kindergarten had parental exceptions for the kids getting vaccines. So basically 20% of the kids in this
That's a lot.
county are unvaccinated.
Yeah. When I was growing up, it was like 2 families out of the whole school. Now it's...
Yeah.
So, Toni, the next slide, are you going to get us canceled from YouTube?
Oh.
What are you showing? What is an epiglottitis?
Well, that's your oral airway.
Oh, okay.
That's your airway. No, yeah, no. So your epiglottis is cartilage that sits in front of your trachea in your neck. So I just wanted to talk a little bit about one of the other diseases we vaccinate for, Haemophilus influenza type B. This is a bacteria. It is not related to the virus, the influenza viruses that have our seasonal outbreaks every year, but it was identified in people who had symptoms like the flu, so there was confusion at the time, and they thought maybe it was related. And anyway, but it is not in any way related. It is a bacteria. And the main issue with this bacteria is that it causes invasive infections, such as meningitis, which we talked about, pneumonia, and then epiglottitis. So as you can see, there's this picture of what your normal epiglottis is supposed to look like when it gets infected with, and we refer to this as Hib. When Hib infects the epiglottis, it gets inflamed, and that swelling closes off the airway. And so we were taught about this in medical school, but once again, from the standpoint of now, due to high vaccination rates, this is very rarely seen. But these kids who have epiglottitis, they come in a very specific way, like leaning forward, and drooling a lot of times because of the pain in their neck.
Is the inflamed part, is it kind of on the back side of the...
No, it's towards the front.
Okay.
It's towards the front.
So the top is the front of the...
Yes. Yep.
Right.
Yep. So, and what's really scary about this is, so the typical way is, if a child's having respiratory distress, and you could see where this would make it potentially difficult for a child to breathe. If a child's having respiratory distress, a lot of times the way you can help a child breathe is, what we call intubation, where literally the tube typically, at least initially, goes in through the mouth, down into the airway, and then you can do that where you basically blow air directly into the lungs.
Well, they can still use their lungs too. That's just getting the air
the
through.
lungs, unless they also have a pneumonia, often the lungs are functioning just fine. It's just being able to get the air past this swollen epiglottis. And so, but when it's that swollen, it can be very hard to get a breathing tube in. Like sometimes they literally just don't fit. So sometimes you do have to do, they would have to do what are called tracheostomies and, do the breathing.
So when that
through
epiglottis gets inflamed, it's a hard tissue. You can't it's not like a spongy thing where you can push something through there.
No, it's hard enough that you can't just push right through it. Yeah. So
about 1,000 died per year.
Yes.
Unvaccinated?
This was pre-vaccine.
Okay.
About 1,000 died per year. So the vaccine became available in 1985. How come
I've never heard of this?
Well, because
maybe I have heard of Hib.
Yeah, Hib. It's probably. And that's the way. If doctors are telling parents about the vaccines they're getting that day, it would be like, and the Hib vaccine. So that may be how people are more familiar to hearing about it. But the reality is, because of vaccinations, we don't see it very often anymore, okay? So, but I can tell you this has really changed a lot of the practice of pediatrics, because this was a big part, just like measles, this was a big part of who ends up hospitalized was kids with these illnesses. who dies, kids with these illnesses. And by 2000, it's not considered eradicated or anything like that, but by 2006, there's, in 2006, there were only 29 cases reported in the U.S., and it's kind of stuck around that level and generally occurs in unimmunized individuals. So,
next slide.
Next slide, please.
Are we going to get to chickenpox?
We are.
Ooh.
So, yeah. So there, how effective is this vaccine? Well, in October of 2008, there was, and this was when it was after it had already become very rare, right? But there were 7 children in Pennsylvania who were diagnosed with Hib and various invasive Hib infections over a 6-month period. So this was, at this point in time, would be considered an outbreak, basically, because even though it sounds like, well, that's not a lot. But when
Is this West Pennsylvania?
That I don't know. I just saw Pennsylvania.
I think there's a lot of cults in West Pennsylvania as well.
We're just going to blame all this on cults. Yeah. So 6 of the 7 kids were completely unvaccinated, and Hib does, it is usually recommended for 3 or 4 doses of the Hib vaccine to get full effectiveness. So one of the kids had only received their first of the recommended doses. And how severe is Hib? 3 of these kids died. So, that tells you a lot. So you asked about chickenpox.
I see a bunch of chickens on that kid.
Right. Look at those chickens. They describe chickenpox.
At least they're not cows.
Yeah. When learning about how to identify chickenpox, I remember being told that the lesions look like dewdrops on rose petals. I feel like that's a little bit too poetic for what you see, but it is. It's like little pustules on top of red spots. So, and they itch, and they, even if you're not horribly sick with chickenpox, generally people with it feel pretty miserable for a variety of reasons. So it actually was kind of confused with smallpox, and they were sort of lumped together until about the mid-1700s, but it's actually in a different virus family, and it's actually a herpes type virus. And if anybody who has cold sores or other herpes variations, these lesions might bear some resemblance to, say, the cold sores you get on your lips, because that's a herpes virus as well. So shingles is also known as herpes zoster.
Wah, wah, wah.
Wah, wah. So
you thought you were over?
Yeah. So did you have chickenpox when you were a kid?
Oh yeah. My brother and I and the neighbor kids and all, everybody had it all at once.
Yeah. I had it as well. Me and my brothers all got it around the same time. It's very infectious, and you can potentially be infectious for like a week before you actually develop the lesions. So, and it's a respiratory.
I never understood how my
pathogen.
neighbor got perfect attendance award at the end of the year that we all had chickenpox. I was like, Are you serious?
Yeah, you're supposed to. Yeah, it was because at the time I had it, it was, you had chickenpox, you're out for a week, and you're out until those scars are all scabbed over, and So, so shingles. So the thing about herpes viruses in general, and there's a lot of them in this family, like, obviously the herpes viruses that cause genital and oral lesions, but also like the Epstein-Barr virus, which causes mono, is in this family. But these viruses are never really cleared from your system. Your immune system keeps them under control. Unfortunately, they can flare again in the future if you are immune compromised, say, and going through bone marrow transplant or something like that. But that's why, say, the herpes lesions on your mouth or perhaps genitals kind of, keep recurring. But herpes zoster, what the chickenpox virus does is it's contained but lives in your nerves. And so what shingles or herpes zosters is when that reactivates, but just reactivates in the pattern of where one nerve innervates the skin, okay? So that's why you get these, herpes zoster will just be in one strip on your side or, sometimes in the face and.
And we're talking shingles.
Shingles. Yeah.
But
the
I hear
official
shingles
name
is
for
like
shingles,
really painful.
it's really painful.
Well, I don't remember
because
chickenpox being very painful. I mean, it was itchy.
Because that's, when you've got chickenpox, the systemic disease, it's not involving your nerves. When it reactivates as herpes zoster or shingles, it's in a nerve, and that nerve is damaged. Okay. So that's why it's so painful. And you can...
It's like struck a nerve.
Yeah. And you can have persistent pain after herpes zoster, after the lesions go away. Some people have persistent pain
so
in
I
those
see
spots.
there are like deaths around 100 a year. Are we talking
Yep,
chickenpox? Are we talking...
That's chickenpox.
Okay. Really?
Huh.
I didn't realize there were deaths associated with it.
I think that's one of the things where people, if we're blunt about it, the chickenpox vaccine is one of the vaccines people often sort of question, like especially people our age, where we're like, well, I had it as a kid, I was fine. Like, why is
chickenpox a disease now? Or vaccine now?
Yes, there is. Yeah. So, so
I know there's a shingles. Obviously, I had that.
Yes.
Kind of required to get it at 50.
Yep.
I think I knew somebody who was like in his low 30s that had it.
No, and it is, I mean, you don't have to.
Shingles.
Shingles is far more common the older you get, because our immune systems, unfortunately, do get a little bit weaker as we age for a variety of reasons.
Should be sitting on the meditation cushion, because mine has been strong as can be this winter.
Yeah. I mean, there is definitely evidence that that meditation, stress reduction, things like that can help, keep your immune system strong. But so prior to the vaccine, and like you said, most of us had it. We didn't have any problems. We're like, chickenpox. What's the big deal? But there were around 10,000 hospitalizations a year due to chickenpox, with around 100 deaths. And the complications are usually pneumonia, so you can get those pox actually in your lungs, basically.
Those would be hard to itch.
Yeah. Right.
Yeah.
And then encephalitis and other CNS complications. So the majority of complications actually were seen in young children, but that's actually because older individuals usually had already developed immunity to chickenpox. But if you didn't get chickenpox until you were an adult, you were more likely to have significant complications.
I wonder if that one death in 2020 was a result of not being able to go to the hospital because of COVID.
Maybe. I mean, we certainly do know that there was some, hesitancy to seek medical attention for a variety of things.
And people getting turned away.
And there were some people who were turned away, or they had long waits and so left and things like that. So it is certainly possible. But yeah, I mean, just a little bit of information there about why we actually vaccinate for chickenpox. Because even if, somebody doesn't have a serious complication, like I said, people, we were out of school for a week. That meant potentially our parents were out of school or out of work for a week.
Right.
So there.
And now with both parents working in most homes,
right. So, I mean, it's, there's a little bit of that sometimes with vaccines too. Like if we can just prevent kids from getting illnesses with, a safe vaccine, like why wouldn't you prefer to just keep your child healthy,
I think some of the vaccine hesitancy nowadays, I mean, it stemmed from COVID, but COVID, I feel like I remember that was like sort of like experimental vaccines.
Well,
rather than these tried and true sort of systems.
Yeah, I mean, I wasn't gonna talk about COVID at all today, and kind of do maybe whole.
We don't have to. We can.
Yeah. Well, but I think just a brief response to that is. So the COVID vaccine is a different type of vaccine than what has been traditionally used. Like we talk about, a lot of the other vaccines that are used, it's like there's a specific protein or something from the virus that our body identifies as foreign and develops an antibody against. Or it's an actual live but, weakened form of the virus, but... So the COVID was different because it's what we called mRNA. So it actually, so you get the mRNA that's in the vaccine.
Which is not a protein. It's more.
No, so it's sort of the pre-protein, maybe. And I think this will be a good topic for a future podcast. But it gets into your system and your body, into your cells, and your body makes that protein, that COVID, that typically would be on the COVID virus, okay? And so then your body develops an antibody against it. And that mRNA, it just disappears with time. It just gets degraded. So it's not like that hangs out in your system. And the protein eventually gets degraded as well, but what hangs around is the antibodies, or the ability for your body to make antibodies quickly and respond to similar proteins in the future. So the COVID vaccine was developed, I would say, relatively quickly over, the time frames we saw in the past for introducing vaccines into the sort of the vaccine schedule and things like that. And, when I talked about the poliovirus vaccine, I was like, they did a study for over a year on 1.8 million kids and things like that.
10 generations of the smallpox one versus like one generation of COVID.
But, this mRNA technology has actually been around for decades. Okay. Mm-hmm. So there was a lot more research, and that's why they were able to develop that vaccine so quickly, is because that mRNA vaccine technology, people had been working on that for decades and knew they would have it for a significant pathogen that we needed a vaccine against. And so they were able to develop it over months, as opposed to the typical, it would take years, to develop a COVID vaccine. So it did go through rigorous testing, tens of thousands of individuals. So, I think, I certainly understand where people would be like, well, that seems really quick to me. But at the same time, I think that people were working on mRNA vaccines for a long time so that they can have a quick response to an outbreak like COVID. So,
That's a good way to put it.
Yeah. And I personally think it was a miracle. I mean, millions of people died from COVID. So,
Yeah, I sell pictures to farmers, and once in a while I hear a pretty dramatic story from folks that had to deal with losing one guy was telling me about his wife, and, how the hospital wouldn't allow him and his family to see her or be with her, really. And
and I think about my dad's now in assisted living, hopefully just temporarily, but I mean, you couldn't visit nursing homes during especially when the outbreak first started.
People waving goodbye out the window, and
and so I just think about that, and I mean, I think there were, especially very early on, I mean, we didn't even really know how it was transmitted. We didn't know, and it is airborne, but we didn't really have enough of the tools, like masks and things can work if used appropriately. But initially we didn't have enough of those things for, people to be able to just go buy it at the store or buy it online. So, Anyway.
Oh yeah, they were gone.
Yeah. Anyway.
This is the last slide. You want to go through this with the flu here?
Oh, I mean, we can just talk about the flu really quick, because I think, the flu vaccine is one that is recommended. It's a yearly,
right? Yeah,
it's a yearly and I was going to look up like actual
I can look it up.
So the recommendation now is that everybody over 6 months should get their flu vaccine yearly, and an updated flu vaccine. People are pretty much aware of what the flu is, but really it's a respiratory virus that causes symptoms like the common cold, but often is more severe. You might see high fevers with it, which people usually don't get with the common cold. People often feel quite achy and may have respiratory symptoms, even beyond just a cough. But It can cause nausea and vomiting and diarrhea, but primarily the issues are respiratory. So it does tend to be seasonal. Outbreaks here in the U.S. are typically from late fall to early spring. I think people don't really realize the severity of the flu because, 12,000 to 56,000 people die in the U.S. every year from
it can be horrible
from the flu. And some years are worse than others. This year has been a particularly bad flu season. I must admit, I don't know how many deaths have occurred this year from the flu, but I know a lot of people have been affected by the flu this year and have, been out with illness and things. Globally, there's 3 to 5 million severe cases per year with 290,000 to 650,000 deaths. I mean, that's so many people, right?
Yeah, so it is a lot. I remember when I first moved to Colorado, I got the flu.
Yeah.
And it was the worst I've ever felt. I mean, I couldn't get up off the couch. I had a dog. I had to bring people, have people come in and take my dog outside to go to the bathroom.
Yeah,
I just could not get off the couch.
It can be terrible. Absolutely. And it is it's a moving target because the strains sort of mutate and new strains are predominant each year, and so that's why a new vaccination is required. I just, as a side note, because of uncertainty about funding and a lot of things going on in the government right now, the annual FDA meeting to discuss the vaccine for next year was recently canceled, and people are very concerned about that.
Yeah. So it says the least effective vaccine recently still decreased hospital. What year was that? Do you know?
I know I saw it when I put that in, but I don't remember. I think it might have been 2018 or something like that, I want to say.
Okay. But, within 10 years.
Yeah, within 10 years. And the efficacy does vary from year to year. And I think one of the reasons it's kind of difficult to convince a lot of people to do the flu vaccine is because they'll say, I hear this so often from patients, well, I got it and I got the flu anyway. And often,
I think that happened to me one year too.
And often,
or I just felt like crap most of the season after getting the vaccine.
And often the goal of the flu vaccine is not, it may not completely prevent disease, particularly because the vaccination rates for the flu are so low that you're likely to be exposed to it at some point during a flu season. And so it's very likely that you get, but the goal with the flu vaccine is that it decreases the severity. So even if it makes you feel like crap for a few days, you're not laid out on your couch, unable to do anything else for, a week, as, sometimes flu illnesses can cause. And who it really is important for are for the immune compromised, the elderly, people who are going to be more at risk with these sorts of illnesses. And I think, I'd love to see higher rates of influenza vaccines. And I know a lot of young, healthy people are like, I don't need it. I don't, and the reality is, if you get the flu, you probably will be fine. But there is this element of herd immunity and trying to protect the most vulnerable within our population. So, the kids I give.
It ain't all about me. It ain't all about me.
It ain't all about me.
We are one large human family.
We are. Yeah. We are. And so I think that's,
There's some argument from people believing that we are actually one large human brain.
Oh, yeah.
Yeah.
Like aspens,
so all that information in your Dr. Toni brain, I could just meditate, meet you on the plane, and receive that because you could
receive all that information.
Yeah,
I'm sending it to you now.
Yeah, I'm hearing it.
Yeah. Okay. or
we are aspens. Yes, we are the aspen tree.
Or a more definitive way to get my information out to people is maybe to just say it and people can listen to the podcast.
we could do it that way. Or we can meditate. We can meet on the hill. Hey, this has been great.
Well, I think this is just the start.
You want to sum up? Yeah, you want to sum up the vaccines?
Yeah, so I think, I think I do have a slide with some summary points on it. Yeah, but I think, people...
It said 17 of 17.
I think people sometimes like to downplay vaccines and minimize like what these illnesses did and what these illnesses could cause. Like even what our esteemed HHS director is saying about this measles outbreak, like, oh, they're just being hospitalized to quarantine them. Like he's acting like they're not actually sick. And this is, vaccines were developed for these illnesses for a reason, because they were a significant cause of hospitalizations, disability, death. And so, that includes the flu. That includes these things we all still experience today, but definitely includes those illnesses that, killed millions of people prior to the vaccines. And so, But we're just getting started here.
And bringing up your that comment that our esteemed director, one you just mentioned, said, it reminded me of a colleague I had, a colleague teacher I had when I was a school teacher. Yeah. And we were all talking about the bullying going on in the school system, and this gentleman chimed in and said, it's just very important that these kids go through it. Oh. Because it. Yeah.
Yeah.
Well, now we look at how PTSD affects people lifelong.
Yeah. Right. Well, and I think I think that is something we'll be when I get to the podcast that's specifically like, what do anti-vaxxers say about vaccines? Like, what have their claims been? A big claim they make is that it actually is better to be exposed and have natural immunity to these illnesses because it strengthens your immune system. And, well, number one, you don't have an immune system left if you're dead. And your immune system, if you have some long-standing disability because of these illnesses, you're...
Isn't that what vaccines do, is they kick your immune system up?
Yes, they do exactly. They do exactly... For your immune system, they do exactly what exposure to the illness would do without having to deal with the illness and the potential side of, the potential downsides of whatever the illness, whatever that may have been for you, whether it's just I missed a couple of days of work, whether it's I'm now permanently disabled, or even I died, But some of these illnesses, like COVID, like the measles, can actually weaken your immune system for quite some time after you have them. So, anyway, all right. So I went on to another topic after I summed up. So,
well, maybe that's going to be the next or one of the next topics of the next podcast.
Right.
But hey, thanks for being here.
Yeah, this has been Dr. Toni's podcast.
Yeah, and
name to be determined.
It's funny that you said, well, I'd like to do a series of 30-minute informational podcasts.
How long was this one?
It's been an hour and 30 minutes.
Oh no.
Which is fine.
Oh.
So, and I hope I pressed record during the whole thing. We'll see if everything worked seamlessly. But thanks for being here, everybody. No, it's great. It was really good information, I think. So we'll pop this up with a really good title and hopefully teach some people some things.
All right. Thank you, Scott.
Thank you.
I did